Hello guys, we are here to discuss and to show the possibilities to work with the program DrPH in preventive care in the clinical area. So we talked about that in our previous video, the possibilities to work about teaching in the university level. And we developed the ideas how to preventive care students can get to this and how many of them are involved on that. And today we are going to talk about individual lifestyle clinic, lifestyle medicine assessments and counseling and how we go by the individual working with individuals. Um, Here is the description of what we are going to talk. Lifestyle, we provide more lifestyle assessments. Usually, doctors don't have much of lifestyle assessments in their practice unless they are familiar with the American College of Lifestyle Medicine. Then we provide lifestyle counseling. We use the structure of health coaching. We promote those techniques, and then there are also healthcare professionals that add preventive care, join preventive care after they have their license, their healthcare license, and most of them are registered dietitian, nurses, physician assistants, but we have quite a few doctors, medical doctors, physical therapists, and dentists. Can I have my own practice? Preventive care is a program that has 50 years already. And we never were able to get a license as a physician in those 50 years for several different reasons. At least we tried two times, one time with the former Dr. Blix, but it didn't go very well on that time. This was in 1992, until 2000, they tried that. Then when I started in 2014, I revisited the idea, and then for us to apply for a license in the country, we have to start with California, and we didn't have many practitioners to do that. So on that time, when I started as a director of the program in 2014, we had maybe 100, 150 practitioners, and that was too low. And the other problem is that we need a budget of at least $500,000 to start an application for a program to be licensed in California, just in California. So fortunately, we get to the point now that we have the health coach. With the health coach, a preventive care specialist with all the training that they have in lifestyle medicine, in prevention, adding the health coach, they might be able to have patients on their own. They might be able to be included in the Medicare and Medical and the health management organizations and be reimbursed. Still working on that, but it looks like the channels are open, and they there is an open way for us to practice as a preventive care specialist and health coach. We could also be supervisors when we have work that we could be above the normal health coach. I mean, health coach could be either a master level or even an associate level. So we are at a DrPH level, so it's a graduate level. So many of our students get promotions when they finish the program because it's considered a terminal program. One of the examples of preventive care specialists that have worked as Clinicians is Dr. Wes Youngberg, and he wrote a few books, and he had a clinic. His first clinic was in Guam. I was in Hong Kong on that time in the year 2002, around 2002, and I visited his clinic in Guam. And then I saw the work that he was doing as a preventive care specialist. So privately, he worked very well. He was not in a system, it was a private hospital there in Guam, a private clinic. I was working in a hospital in Hong Kong as a preventive care specialist or health education specialist. And then I visit to get some ideas because they had a good work for diabetes prevention at that time. Dr. Wes Youngberg worked with diabetes. He even designed a program called Diabetes Undone. You can check on that, Diabetes Undone. And now he is focusing also on the prevention of Alzheimer's. And that's very interesting that he became very intense and very well known in the country with these 10 steps to optimize brain health. So you see that as a clinician, you can work as a clinician, and Dr. Wes didn't even have the health coach, but he has the certified diabetes educator. Um, Here is a list of practitioners that used to work as preventive care specialists, clinicians. Dr. Ernie Medina, Dr. Ruandala Godot. Both of them are working now as professors in the School of Public Health. Dr. Silva Kremer used to work for Beaver many years ago, and she is now in the School of Nursing, working in the intensive lifestyle programs there. Dr. Ala Alabadi Birman used to work for Beaver also. Dr. Kenneth Stewart, James Atolabi. James Atolabi is now in Nigeria. Our program is very international. He finished preventive care. He ran a few clinics in California for weight management for a few years, and then he moved to Nigeria, where he is the provost for an university, I believe, is in Lagos, the capital, close to Lagos, capital of Nigeria. Dr. Keith Horinushi was working with Dr. Wes Youngberg in Guam, and he is still there in Guam and has his own clinic there. Dr. Edward Nathan and myself as clinicians that work. Well, I work as a clinician because I was a medical doctor, but I am not licensed in the United States. So my share here is as a lifestyle counselor and health coach. Very big number of dietitians shows preventive care are their terminal degree. They finish their masters in public health and join the preventive care to get a higher level degree, and then they are able to teach. They are able to have a little more experience with patients and have a broader experience than just having nutrition. One example of this was um, Dr. Jocelyn Patterson. Jocelyn Patterson um, became the director of nutrition for Morgan University back in Washington. And then she got a promotion and she was just a dietitian, but with the terminal degree of DrPH, she was able to get there. Same thing happened with Michelle Pechek. After she finished the preventive care, she was a professor in Cal State Long Beach for quite a while. And then when she finished the DrPH in preventive care, she was promoted. One of the most famous preventive care specialists that succeed, I would say, was Dr. John Westerdahl. I met John Westerdahl when he was working in Hawaii. And in fact, when he left Hawaii, he was working with the Castle Medical Center in Hawaii and developing the lifestyle department there. He said that he has a job for me to follow him. And I almost went to Hawaii to work there, following his steps. However, at the same time, I got a call to come to Loma Linda. And between Hawaii and Loma Linda, I chose Loma Linda. That was great for me. My kids didn't like that, but life is life. But John Westerdahl, the guy that is here in this picture, today he is responsible for the nutrition component of the American College of Lifestyle Medicine conferences. So every single conferences that you attend, this is the guy that organized the menu and organized the the whole thing about what kind of foods we should serve, mostly and always plant-based nutrition foods or vegan foods, if I can say that. So it's a good profession. He is the one that has a nutrition by the American Dietetic Association. He has an RD, and also he has the certified nutrition specialist, and he was even a high-level member of the American College of Nutrition, um, the CNS. I have also the certified nutrition specialist, and many preventive care, we advise them to get this if they cannot get the DRPH, the RD in nutrition. And he has a radio program, Life Talk Radio, and we are good friends with Dr. Westerdahl. As I mentioned, there is quite a bit of physicians, both national, I mean, in the US and international. Most of them are international, as you see the list here. And I just want to mention two of them. One is Dr. James Peters, a very good friend also, and a very successful guy. He was a respiratory therapist and also a dietitian. And then he has the DRPH. So he finished the DRPH, finished all this course, and then decided to go to medical school. For a few years, he was the director of the Santa Elena Hospital Lifestyle Center in Central California, close to Napa Valley, close to Sacramento, on that area. Unfortunately, he had a cardiac complication 2 years ago, and he passed away. But he was one of the good ones, one of the best preventive care doctors. The other doctor is Dr. Edward Nathan. Edward Nathan was in Malaysia in charge of the first program to stop smoking online. Before we have those things here, now it's common. You want to stop smoking, you just go and there is some online courses that you can do, programs that you can do to stop smoking. Dr. Nathan invented this maybe 20 years ago in Malaysia and was the first one. He was always involved in prevention and smoking cessation in his country. Now, Edward Nathan moved to the Philippines. He is working in a university, an Adventist university, and he is in charge of the health education program in that university. They have a master's in health education, and he is the guy in charge. We have quite a bit of nurses in the program, and here we have a list of them. I can mention Dr. Rosie Sakamoto. She was a nurse from Azusa University, came, did the preventive care, and then was promoted there, and she has a group of nurses that she still teaches, and have referred those nurses to our programs as much as she can. Last time we have a symposium on March this year, and we invite her to be the coordinator of the symposium, and she's a very good friend. So nurses are involved, and most of the time they want to have um, an extra preparation for dealing with diseases that are not just medications, that are not just to be treated with medication. Most of the healthcare system make a diagnosis. Okay, you have diabetes, you have metformin or Rybelsus or whatever drug. But if you don't have lifestyle, you are not doing a good service to those clients. That's why a few nurses or many nurses join our program. Tracy Dawes was a different case. She was a preventive care specialist, and she figured out that if she has a nurse practitioner course program, she could do much better for her community. And that's what she did. She finished preventive care and entered in the nursing school. And today she is a nurse teacher and nurse instructor for the National University. And but the best thing that she did is that after she finished her nurse practitioner course, she opened a non-government organization, and she has a clinic in Riverside to attend those that cannot pay. And a non-government organization, if you want more information how to open that, she she is willing to help, because she came to one of our grand rounds and present the topic of how to start a non-government organization to help the community. There are a few of our preventive care specialists that are also mental health professionals. We just graduate Dr. Krista Lamont, and she is a licensed marriage family therapist for many years, and then she decided that to help more her clients, not just with psychological theories, but with lifestyle medicine, lifestyle modification. She should join our program, and then she just graduated last week, I would say, in our 2026 graduation team or group. Here with me, we have Linda Silver Bridges Williams. She graduated last year, and then we just published her paper dealing with caregivers of Alzheimer's patients. She is a she's a social worker, and then she joined our program, and was a rich experience that she had with, she is always involved with Alzheimer's prevention, and mostly with the caregivers of Alzheimer's. We have a few dentists, Dr. Abrar Bardezi in the picture, Dr. Samir Hamoudeh in Qatar, and Sandra Schmidt. Sandra just joined our program, and Dr. Bardezi and Dr. Hamoudeh, they left already. One is they went back to their countries. We keep contact with Dr. Bardezi, because she is writing a few papers for us. She is now working in a university in Saudi Arabia in the area of prevention and oral health prevention. So very, very interesting how diverse our students get on these areas. And this is Carla Feider, and then we get to the health coach. So I mentioned about some clinicians that are already clinicians or become clinicians, and now the ones that don't have anything to do with clinician, they just join the preventive care, and then enter in the field of health coaching, as I mentioned. Carla has an interesting story. She was she came from I think her family is from Jamaica. I met some relatives of her when I did a mission health fair in Jamaica. And she finished preventive care and decided that she would go to nursing school. She registered for the nursing school. When was ready for her to start, we got a invitation for preventive care students because they need a health coach to work in Northern California. He was in an Adventist hospital there. So we shared that information with Carla, and Carla jumped in. And then she went there. On that time, we didn't have the health coach that we have. They just have the ACE health coach, and then certified health coach. And then she jumped on the opportunity, start working there, and then worked there for a few years. Dropped the nursing school because she was happy with what she was going, she was doing with her profession, and then moved to CVS, working CVS until today. She is working for CVS as a health coach. CVS has been a pharmacy that is more open for a lifestyle modification and health promotion than any other um, pharmacy in the country. I'm not sure if you remember, there was a time that they stopped selling cigarettes in the pharmacy. I think many pharmacies follow the same pathway, but it did not make sense. Pharmacies selling cigarettes, and CVS was the first one to do that. But Carla, until today, she is communicating with us, and then she has this experience as a health coach. The other one that is a health coach that we would like to report is Dr. Ruben Shipuli, also graduated this year, 2026. He has been our follower in Drayson Center. Drayson Center is a gym in Loma Linda. I used to run a lifestyle center on that gym for about 13 years. And then Ruben is the follower. He is in charge of. I retired with that, and Ruben is the preventive care specialist that is running the center. He was interviewed here by Dr. Richard Hart because he is involved in missions. He goes to Africa, to Mexico, to South America, to wherever there is a mission, Rubens is involved. He goes as a preventive care specialist, and his wife is a physician, pediatrician, and they go together in those mission trips. And Dr. Hart was amazed and asked him what is that he learned, what was his experience, what was that he could share about the mission trips. And then a list of health coaches. As health coach is, I would say, is a brand new specialty that is coming under the medical field. The American Medical Association is developing the CPTs that will create codes for the health coach to be reimbursed in the medical system, first in Medicaid and Medi-Cal, and then for other healthcare management organizations. And then the list is not big here because we are just starting to have our students involved on that. But still, we have a few. Dr. Carla Fader, as I mentioned, Ruben Shipuli, also I mentioned. Dr. Ernie Medina is the guru of health coaching. He is the one that started the health coaching in Loma Linda. He teaches most of the health coaching courses, and then he helps students particularly to take the exam. I also I am a national board certified health coach, as well as Dr. Gregory Cohen and Dr. Ruandala Gudo. Dr. Wanda Godot is a graduate in preventive care. She used to work in Beaver. She joined now, she was hired this year or last year as the director of the Masters in Public Health and the Health Coach Program in Loma Linda University School of Public Health. So finalizing all of this presentation about clinicians and preventive care, there are three options here. First, you have a license. So some of you that are listening here already have a medical or a healthcare license, healthcare professional license. And then you add preventive care that will give you a little more skills in terms of prevention. Then the second option is that you finish preventive care and you figure it out, hey, I could do more. I just have a student called Claudia Boafo, just graduated in preventive care. Before she graduated, she already joined the nursing school. She figured out, hey, with a nursing degree, can do much more. It does not need to be like that, but if you want to be more clinician, more recognized, is good. And then that's the second option. And third, you sit for the National Board Certified um, Health and Wellness Coaching. Health and National Board Certification of the Health and Wellness Coaching exam. So you become a health coach, and with that, again, you can have access to patients, and the American Medical Association is working on the official, make it official, is working on the regulations of this profession in the medical, in the healthcare field. So three options if you want to be a clinician. Thank you very much. I will go and finish the next. We have two more sessions. One is corporate wellness and another is general public health. Those are other videos that I will prepare for you. Thank you, and consider joining preventive care. Even if you are not a clinician, you can be one. But if you are not interested in being a clinician, there are other areas of preventive care that you can apply. As I mentioned, teaching, instructors in universities, and working in general public health. We will go back to that. Bye-bye.